Welcome, everyone, to today's webinar, How Children's National is Reimagining the Family Experience. On behalf of Becker's Healthcare, welcome, and thank you for joining us. Before we begin, I'm going to walk through a few quick housekeeping instructions. If you have any questions throughout today's webinar, you can type those into the Q&A box you see on your screen. You will find a few engagement tools on your dashboard. Please check out our resources section and also make sure you fill out our session survey. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. Lastly, if at any time you have trouble with the audio or video, please try refreshing your browser. At this time, it is my pleasure to turn the floor over to our presenters to begin today's presentation.
So hello and welcome everyone. My name is Dina Kraft and I'm part of the Salesforce Healthcare and Life Sciences team. And it is my pleasure to be joined by two remarkable healthcare leaders today, Matt McVeigh from Children's National and Mike Beatty from KPMG. And we have had the pleasure of working with both Children's National and KPMG on a project to improve the family experience at Children's National. And we are just thrilled that both Matt and Mike are willing to spend some time with us today to talk about the project. So to get us started, I'll just ask that each of you tell us a little bit about yourself and your organization, and then we'll talk specifically more about the project at Children's National. So Matt, you want to get us started?
Yeah, certainly. And thanks for having me this morning. Just by way of background, I've got a 22-year, just past the 22-year mark, career in healthcare IT. Really dedicated to starting in the early days to early EHR implementations, both domestically and did some global work with the National Program for IT in the UK for a period of time as well. And then moved into IT service delivery in CIO roles, both through outsourcing arrangements and then direct as CIO here at Children's. So I came to Children's in 2017 to lead a collaboration called the Bear Institute for Health Innovation, and really then ascended into the CIO role here. And it's been absolutely fantastic to work for this organization that's heavily, exclusively focused on the needs of children, both in our region and globally. Children's National is a 400-bed hospital here in the DC area, but also has a large clinic network throughout the region. And as we continue to think about our growth and transformation, heavy presence and focus in virtual care and other initiatives, and we're proud to be a top 5 hospital in the nation by U.S. News and World Report as well. So with a huge academic medical center presence and research organization as well.
Congratulations on that recognition, because it demonstrates the impact that you're having on children in your area and probably even more broadly than that. So congratulations. Mike, how about yourself?
Well, Dina, thank you. Matt, thank you for the opportunity to connect with you two today and talk a lot about what Children's National is doing. Those are some great accolades, Matt, and really I would congratulate you as well. I'm a partner in our national healthcare practice at KPMG. I've been with the firm for about 24 years now, focused on mostly the provider part of the healthcare continuum, thinking about performance improvement, strategy to realization, in implementation of lots of different types of technologies, and more the intersection between modern technology and legacy platforms to create better experience for our patients and families, better experience for our caregivers and physicians, as well as the administrators that support the system. So I appreciate the opportunity to share some of those stories today, and I look forward to the conversation.
Thanks, Mike. And thank you both for your service to our industry. Between us, we've got several decades. I don't want to count them all up because it will age all of us, but our organizations have had really the privilege of working together to help improve the family and patient experience at Children's National. And Matt, I'd love for you to just ground us all in the endeavor that you embarked on at Children's National and what the organization was trying to achieve by engaging both of our organizations and working on this strategic initiative at your organization.
Yeah, happy to do that. And it really, the work we're doing today is really part of a progression of work that I think parallels a lot of healthcare organizations like ours, where we, really started years ago with the traditional patient portal relationship, kind of an authenticated experience for our existing patients. And then over time, evolving to different digital capabilities, including the ability to check in and complete pre-visit information, and even do online bill pay and other things. But as we've kind of progressed and looked at both the needs and expectations, demands of our population, that's those early stage digital experience pieces, just it's not enough anymore. So we embarked a year ago on a journey with Salesforce and KPMG to really expand capabilities and create a source of a data source so we can actually more robustly personalize those experiences and deploy capabilities that have context around the patients and families we serve. Certainly, as I think many of us can attest to, who as parents, this can be a very frightening. Engaging with a children's hospital for a specialty referral or a visit around your child's health or wellness can be a scary time. And how we do that in a thoughtful, empathetic, and personalized way really starts with how we understand who we're working with. And so we've set out to do that. And then build digital capabilities on top of that data and understanding of our population.
Thanks for that, Matt. And Mike, I'm sure that you're hearing similar aspirations around the country as you're talking to other healthcare organizations. Anything that you'd add for what you're seeing more broadly in the healthcare industry?
Sure. I think this is a very hot topic and has been for several years. How do we create a better experience? How do we create the same type of experience in healthcare that we as consumers have in other industries? We like to say that our best experience anywhere is our expectation everywhere. And we live in a very digital, very context-driven world today. And so more and more of our healthcare system clients are trying to solve for this through different methods. Many of them involve significant technology endeavors, and what Matt and Children's National are doing with Salesforce is one of those unique, I think, experiences to watch and look at as they really push the envelope on creating experience that, again, serves the patient and the family. And pediatrics, it's not just the patient, it's the caregiver network around that child, as well as the internal side of the equation with physicians and nurses and other support staff that really need to understand that context at a bunch of moments of impact throughout the care continuum. So it's a very top of mind topic in almost all of our clients, very challenging technology architecture sometimes to solve for, but partners like Salesforce have done a really good job of bringing capabilities to market that make this easier to do. And we're excited about the possibilities over the next few years in situations like this.
Yeah, and I think both of you have touched on an important point that this really is an evolution, right? We certainly have more technology capability than we've ever had before. I think the EHR had, gave us an infrastructure and a foundation we didn't necessarily have a couple of decades ago. And then in addition to the technology evolving, expectations have evolved of both our caregivers, our clinicians, our families, and our patients. And so there is sort of like a world of possibility that we're all truly unleashing. And Matt, as you shared, this is part of a journey that you've been on, that Children's National has been on for a while. And maybe you can just paint a picture of where you're at today and where you're looking to head in the future as you continue this journey and as capabilities and expectations evolve.
Yeah, certainly. So I think we are. I think we've built the foundation now. Again, building up the legacy of some of the solutions we put in, and then now having Health Cloud at the center as really the key knowledge repository to allow us to build capabilities on top of it. We see a lot of promise in continuing to, both provide, just multiple channels of communication and engagement with our families, our patients and families, but also better being able to better manage the referral experience with our referring providers, and invest in more thoughtful ways to do waitlisting and making sure that we're maximizing the opportunity of our providers' time with late breaking cancellations and other things. So the platform, and really our thought process is to make sure we're designing and thinking around this and capability holistically, but really solving for the most urgent, both business and user consumer satisfaction needs. And the other part of this, I think, for us is making sure that we're also being very thoughtful about our user experience as well. There's really, it's one experience at some level, and how we make things easy and accessible as well for our staff, and particularly with the focus of some of our early stage work with our contact center, does enable them and put them in a position to best serve, but also have a best experience with our technology, right? It's really one experience when you think about it, because there's so much reflection that happens in that in how we serve our staff as well. So streamlining knowledge, streamlining communication capability, et cetera, all do that both bidirectionally for our consumers and for our staff.
Right. And, when we hear the word experience, we think about our, consumer experiences, we think about how we feel, we think about ease of use, but you hit on probably one of the most important parts of the experience, which is just access, right? I'm sure, like many pediatric institutions, certainly in the top 5, you have the world's best working in your organization. And if there's a canceled appointment and not an opportunity to see another child in need, another family in need in a timely manner, that's a difference maker in many cases. So access, I imagine, is pretty core to the work that you're doing at Children's National as well.
Absolutely, it's front and center to us, and certainly going back to just what a difficult or scary time it can be trying, with a pending appointment, and how we both communicate, keep a line open of communication and use technology to do that with our patients and families, but then also how do we accelerate using capabilities to get folks to the right slot, to the right provider as efficiently as possible is critical. And so we do think there's definitely a role for technology to continue to allow us to do that, to help get people into our organization in the hands of our specialists as quickly as possible.
Certainly. And in our industry, we have big, complex problems. And Mike, I'm sure you encounter this every day, where we're trying to, your clients are trying to solve some of these similar issues. And I wonder if, as your clients are thinking about access and patient experience, what words of wisdom do you have in both what to think about up front and how to avoid maybe common pitfalls that you see with these types of endeavors?
Yeah, I'd love to put an exclamation point on this topic, because the best digital infrastructure will only get you so far. The most advanced usage of Salesforce to create experience will only get you so far if access is not optimized. There's nothing worse than having a really awesome channel experience, whether it's through the contact center or through an app or some other digital means, only to find out there's actually not an appointment for you. Or it's 3 months away, or it's in a location that's not aligned with where you are. And so that's a challenge. It's a big challenge, and it's also a very significant opportunity. The challenge is getting the organization to line up behind the new experiences that you're creating, and that means everybody, facilities, the physicians themselves, the support staff, the contact center alignment to that capacity. getting them to all sort of align to the new capabilities you've created to get the most out of them. But the opportunity is significant when that happens in an orchestrated and efficient way. And we've seen health systems create really, really amazing, I guess I will call them gains, by getting those things to match up. Lots more time and places to see patients earlier, so lower wait times, more aligned with when they want to see you versus when you're available to see them. Our studies show over several years that appointment wait times is one of the initial biggest drivers or detractors of patient experience in a health system. And so really thinking about how to organize operations, optimize physician time, templates, scheduling patterns and flows is really as important as thinking about how to deploy the technology to make those processes go better. But it is definitely something that is being dealt with across the country right now. I think we're entering into a phase over the next several years now that we have the post-COVID experience, the new technology capability, resources that will forever be constrained. Making all that work together to create a better experience is a big mandate right now in many health systems.
Yeah, and if the first exclamation point of this conversation is access, I think the second exclamation point is, technology is not a magic wand. It is an enabler, and getting the organization behind any kind of change is the secret sauce to making any kind of change endeavor successful. And Matt, we talked about this last week in terms of, words of wisdom or pitfalls. And you talked about the importance of the collective healthcare community and the sharing that happens, the networking that you do with your peers and other organizations. And I wonder if you might lean into that topic a little bit and offer some guidance for folks who are joining us today.
Yeah, certainly. I think first and foremost, and this is one of the things that this collaboration with Salesforce and KPMG has afforded us the most, right, is connection to like-minded organizations that are on the same journey towards more efficient access, more personalized experience for their consumers, and I think that has been absolutely critical. We know that there are some things that we're doing that are worthy of sharing with others, and we know that there's a lot of organizations that are even out in front of us that we can learn from. Healthcare as an industry has always been open to sharing, but having good partners like Salesforce and KPMG that can make those connections to how others are addressing common problems has been just amazing. And we were privileged to host a collaboration of like organizations on the East Coast, lots of recognizable names here at Children's National a couple months ago, and it was just getting the answers in the room, right, to a lot of the challenges we're solving, and getting that collaboration was just great. I would also, just as far as words of wisdom, and just to really bring home this theme, as you embark in these efforts in your organization, it has to be about the right blend of technology that can support personalization, but it also has to be about the people. That the technology itself is not to wholly replace this human-to-human experience. It's how do we make our staff and who's delivering that experience, whether they be at the contact center or at a clinic check-in desk or a care manager that's supporting kind of ongoing care delivery. How do we best enable them with the right information, with the right understanding to deliver kind of those kind of more magical moments? It's not to replace them, and I think that's really, really important. And engaging them and in that way, and making sure they understand what our aims are as we deploy technologies like Salesforce, I think is critically important for organizations to understand. Start with that understanding of who your stakeholders are and how they are going to be engaged, and that will set up projects for success.
That may be our third exclamation point of the conversation, is how critically important staff, whether they're in a clinical role or a non-clinical role, is to delivering quality care and magical moments. And Mike, I imagine that staff within particular providing organizations is a very hot topic these days. So anything that you'd like to add there?
Yeah, it is a challenging and very hot topic, has been for a few years now. Many systems are thinking about how to get the best out of the staff they have, controlling cost in an inflationary world. Technology can help empower those individuals in a different way. And Matt really said it nicely. We want to, our caregivers are in fact why someone is coming to see us. And so using technology to put those people and professionals in the right spot at the right time to make an impact on that patient's life is really the focus. And so we see lots of unique strategies related to that, both in the access and experience world, but also in the clinical domain itself when we're actually providing care. And the things we've been talking about here today with Salesforce began the journey, but a lot of the information and capability of the platform allows that information to follow the patient, follow the process, follow the experience through the continuum of care, which makes your caregivers and support staff much more efficient, much more relevant, and I think ultimately drives a better experience and health outcome.
Absolutely. I think one final topic I'd like to cover today, Matt, in your role as the CIO and with your team, I have to imagine that you are connected to virtually every strategic initiative at Children's National, because technology is such a part of pretty much everything we do today. So thinking about all of your stakeholders internally, and then all of the vendors and partners that you work with externally, I'd love your perspective on how you think about partnership in terms of how do you select the organizations that you want to partner with? How do you ensure that the outcomes with those partnerships are achieved, and manage this wide ecosystem of touch points, both inside your organization and outside of your organization?
Yes, it's a great question, and absolutely right. The work in front of us, and even the work we've achieved to this point, right, is unthinkable without strong collaboration and partnerships. And at Children's National, we've always been an organization that's really thought about how we maximize the value of partnerships and achieve a lot more in collaboration. I think starting on the internal side, to the first part of your question, certainly it is a unique position to be in as a CIO of a academic children's hospital with a large research portfolio. There is in a lot of cases, it's how we work to connect and make connections across the organization, because it's kind of a unique position to see everything in a lot of ways, right? And hopefully in a neutral way. How can we go help solve problems that have enterprise impact as different important parts of our business are trying to progress their areas? How do we make those connections across, build relationships and build trust? The work that as things have moved from kind of the EHR area to the digital work we're talking about today, it just is called for more and more deep alignment with the business, right? Because the capabilities and the technology and our ability to evolve them and to really tailor them to to our workflows and our desires, just demands that we're tightly in sync with the business and how they want to, how we can improve their effective delivery of process and change process. So it's become, in a lot of ways, less about being technologists and more about being, change management and communication experts. And that's been an evolution. And I think then segueing up to the partners we choose, partners that are good at helping us do that, connect the dots, providing, I think first and foremost, there's the fundamentals, right? Trust and integrity, but the organizations that we work with, we like flexibility, right? Because things change. When we set out on a project, then the initial scope of work is rarely what the delivered product is. And so how do we manage through those? How do we manage through those changes and what we ultimately want to need to deliver for our staff and the patients and families we serve? We need flexible partners to allow us to do that, and partners that are willing to say, wait a minute, I think you're going down the right path, right? Willing to stand up to us in some regard and say, here's what we've seen. Again, back to the connection points to other experience. And I've really appreciated that, both with our work with KPMG and Salesforce, to say, that might be okay, but here's maybe a better path. And being willing to do that for the best outcome is really, really important. So.
Fantastic. Thank you, Matt. Mike, any other final thoughts from you?
Well, I think that this is an exciting time we're in, as I've said, and Matt's right. It takes a village, so to speak, to pull off large-scale transformation, and being an agent of change, being able to stay the path is an exercise, not just in being very good at technology. It's being very good at a lot of things, and that's how we sort of bring ourselves to our clients. And to Matt's point, we like to share alternatives. We like to challenge, status quo to get to the best answer, and ultimately a positive ROI-driven answer, which is another thing we haven't really talked about a lot today. But we are really trying to think very holistically about how investments in these technologies or capabilities otherwise really drive a strong return for the business across multiple domains. But it's a unique opportunity to see all these things come together in this way versus maybe 10 years ago when we were really just talking about the EHR and meaningful use and how we get off the ground from paper in many health systems. So happy to be a part of this. Children's National is a great partner. Salesforce is a great partner. And I think we'll hopefully maybe a year from now, we could revisit this and talk about outcomes and other interesting learnings and achievements.
Yeah, we'll see that next chapter of the evolution. And I got to say, this is what I love about our industry. I love, Matt, to your earlier point, I love the collaboration that occurs within organizations, but then across our respective industries. And one thing I know is that none of our respective organizations have all of the answers. So it will take all of us to tackle the ever-evolving set of challenges that we face. But there is no bolder or more important initiative than improving the health of our children and of everyone's lives broadly. So thank you both for your time today, for your partnership, and most importantly, for your commitment to this industry. And we look forward to hearing chapter 2 of this story. Be well, everyone.
Thank you.
Thank you.
That is all the time we have for today. I want to thank Dina, Matt, and Michael for an excellent discussion today, and also to Salesforce for sponsoring today's webinar. Thank you for joining us again, and we hope to see you at future Becker's webinars.